for life on the 25 budget. Brady is here to keep working through language and has provided us with a document here to walk through. So why don't we get started? And some of this is going to look familiar because it ties into the T-bill that we've just discussed. So I'll let you start, I guess, with the B 1100 section language.
Yes, Grady Nixon, fiscal office. On the first page of this document, you'll see changes to the B 1100 section in sub J 1 and 2. These are the SAC replacements of House language. So rather than going with the House 2 one-time pieces that were in there, these 2 one-time pieces comport with the T-bill. You'll see in sub 2, there's language clarifying because these funds are contingent on revenue generated by the electric plug-in hybrid vehicle road usage surcharge. It clarifies that if the revenue generated by that surcharge is less than $900,000,
We're changing usage surcharge, so that needs to be updated.
Yeah.
we'll make those changes.
Okay.
But that language in sub 2 there, just to
So you don't
clarify.
overexpend.
Exactly. In sub N of the 1100, this is language to make sure that the general fund and federal fund match for global commitment for the Medicaid Global Commitment Payment Program is there. It includes language to say that if the program ceases to operate or changes methodology to a retrospective payment program, any resulting one-time general fund spending authority shall be reserved in the Human Services Caseload Reserve.
Mm-hmm.
And then a new sub O, which reflects the global commitment funds for that program.
So that's what we had to agree, the 3.9 for 5 hospitals to pilot the global payments. And that's the language that's been recommended from DEVA. So I'm gonna close that out, and that is to fund the tail claims and could come out of the caseload reserve. So that does not, which is a permissible use and does not obligate any of the very precious general fund we have. All right, with that, Senator Lyons, you love it, right? All right, moving right along.
On page 3 of the document, this is an addition to section B 1103, which is the cash fund appropriations section for FY25. Sub 11 reflects the Senate Institutions Committee addition of a $30,000 appropriation to DFR for the Lake Champlain International Fishing Derby.
Right up there with a fish hatchery
And the walleye.
and the walleye. But this came out and was freed up by taking something that was general fund and moving it. So are people willing to make? Yeah, all right.
Yes.
On pages 4 and 5, this is a new section C 116. This is language to ensure that if there's a disruption to cash flow caused by the Change Healthcare cybersecurity incident, that funds shall be unreserved from the Human Services Caseload Reserve for appropriation to the Secretary's office for net neutral transfers.
What's being held up are the pharmacy rebates. And so those rebates were anticipated as available revenues. But because of the delay and that the pharmacy, which we've all read about or heard about, creating this one-time cash flow. So this is advancing it out of the caseload reserve with the requirement that once the rebate, the equivalent amount is replaced. So this allows us to end the year in balance. So we'll move on.
On pages 6 and 7, this is a new section C 117. In Act 78, there were funds appropriated to VSAC for the Vermont Teacher Forgivable Loan Incentive Program. The corporation believes that there may be funds available at the end of FY24. So this adds a sub E, which would allow for those funds to carry forward.
Carry forward authority. committee, I'm gonna keep going on something.
Yeah.
Just trying to get all the language we need to go. All right,
On page 8, this is in addition to section V 103, the reserve section for FY 25 in sub C. You'll see that 3.913 million is unreserved from the human services caseload reserve.
that doesn't.
On page 9, this is a new section D 104. This is essentially needed placeholder language for the pay act. We don't have the pay act language yet, but this reflects the estimated numbers for it. So this is language necessary for the bill so that the pay act could eventually be introduced into it.
Is that meaning that at some point down the road in the conference or whatever, we swap out?
Hopefully by tomorrow or when we vote this out, we'll have the pay app language available.
Okay.
But we'll have to hold that. And do you know the status? Who is drafting pay act? Is that Damien?
Lead Jen Carvey.
Oh, Jen is doing that too? Okay. And you have some sense of what her time, well, we can ask her at 2:30.
Yeah.
Yeah, okay. Can somebody hold that thought?
Right.
Dr. Dinosaur premium invoicing suspension.
This is recommended language from DEVA. I would clarify for the committee that this is section E 306. DEVA recommends that the current E 306 is not necessary to include in the bill. So this isn't a replacement of the language that is in the bill. It's that the language that is currently in the bill can be struck. So this would not be replacing the intent of the current section E 306.
What is number 2? At such time as the agency reinstate. No, they, okay, if they had a arrears on the premium, it's the slate is white clean. Can we start over?
Madam Chair,
Yes.
question about line 10 through 13. I'm just wondering about the shall not attempt to collect or take adverse action against an enrollee or the enrollee's families as a result of any unpaid premium balance incurred prior to the public health emergency. I'm confused about why that is.
It's basically saying if you fail to pay your premium back prior to the, when premiums were in effect, you have no obligation. It's kind of wiping the slate. You don't have.
Amnesty?
Yeah,
Yes.
Okay.
Because there's a lot of it, or like, what's the reason? We don't care.
I don't know, but probably to go back and attempt to even calculate it. It's better to just simply wipe the slate
Just cleans it.
and clean it up and start new once you start premium. And that may be something that we have to consider again, if in fact we want to support the more ideas for Medicaid.
And with the IT system.
Yes, so we're okay on 306 then for now, realizing that we probably will go back and revisit reinstituting premiums. If not in 25, but in future years. E 204. This is, I think we had agreed on this language. It just said one would be funded with the money that we had moved for the CHIMS, for the tobacco litigation settlement appropriated to judiciary. This is I think it was the master now that's now.
Yeah.
So I think that's okay. All right, and then we're down to 106, and that is taking out the 3 million from the 7 million that is there to go to use for the child welfare information system. And we agreed that we would do that, so.
And for finance and management, so the Senate change here is reducing one of the allocations and unstriking the allocation of 750 in fiscal year 2022 or after as needed, so that it's clear that the funds allocated in this section are for the Chin's judge in the prior section.
Okay. So this was this part of the technical matter?
This was flagged in the technical letter, the language wasn't there, the JFO, had conversations with finance and management to find something that would be workable. The next several pages, beginning on page 13 of the document, these are adjustments to VSAC and AHEC, loan repayment and forgivable loan programs. Many of these changes are technical in nature, such as changing healthcare provider to professionals. The position of a medical technologist and a medical technician are distinct from one another, so the language reflects that.
And we've got the carry forward on page 15.
Yes, so multiple sections of this chapter have a carry forward authority in them. And the term forgivable loan is unworkable for AHEC, so that has been replaced with loan repayment.
But still using on page 15.
But on page 19, it still says forgivable loan needs.
For AHEC programs, it is loan repayment. For VSAC programs, it's still forgivable loan. And those changes continue all the way to page 23 of the document. And I would note for the committee, these statutory changes in the House version of the bill took place in 2 sections. In the Senate version of the bill, will take place in just this one section, E311.1.
And I know that was included in the report, that these language changes, and Nolan's had a chance to review that because he was one of the authors of the report where these recommendations were included. And so we have said, let them coordinate the language and confirm that it's right, and we're going to have confidence that has been done correctly. So with that said, I'm going to move on to public inebriates. And this is language that we have recommended from Senator Westman and Senator Lyons in terms of
We added the Department of Corrections to that,
to where,
to the stakeholders.
oh, we should, because oftentimes the individuals
Right
end up
now,
at
I
the,
just
at
know
the
that
host
they're-
of public safety, but not corrections.
Pardon me?
We did
Yeah.
public safety, but.
We did public safety, but not corrections.
That's fine with me, it just, is-
Should have had one. So,
Fine.
so we should add.
they're the
DLC.
ones that are taking the public inebriates. There's no space for it. As a matter of fact, in the new women's facility, they have 2 beds allocated for public inebriates.
Well, as many as 5, but then you're gonna maybe have to move 5. Because you've already got 1, 2, 3, 4, 5 here. Did you wanna have more than those?
5 stakeholder meetings.
A meeting, 5 meetings, sorry, not 5 stakeholders. 5, you like, channeling Senator Nitka, is 5 okay?
But it's not a,
And nobody gets paid,
nobody gets paid.
because they're all getting paid anyway.
Well, the turning points are,
Well, they,
some of them are volunteers.
well, depends on who's appointed. Well, we don't have any provision to pay them.
It's okay.
I would think that we do have paid staff who probably could participate in these.
They do have days to have you.
So this is coming to try to see what we can do to
Yeah.
get more,
Have to
yeah.
make effective the 1970s.
Well, did we still, have we,
I think
did we finally repeal it?
no, I think we could extend it, so it's,
Well, in perpetuity, apparently, because we've been doing it, I think, for 20 years.
And the problem is you've lost, we've had
a lot
two,
of beds in oil and Franklin.
well, in Howard Center. And they've all pulled out, and the money that funded their programs, the grants that went out are still sitting there. They haven't done, and there are other agencies in the state thinking about pulling out. And the health department says, well, it's staffing, and all of the agencies say the people they're serving are getting harder to serve because people are coming in violent.
I don't disagree with, it's a little distressing that we have to be this instructive in the budget to do something that one would hope could be done as a matter of administrative
25
response.
years.
Huh?
25.
Well, but this is, that in fact, Lamoille County had its beds taken offline,
Mhm.
4 beds. And so we've been talking about the need for alternatives to having individuals end up in our correctional facilities by default. And it seems like the concern is that there hasn't been confidence or an indication of affirmative action taken by, it would be probably what is now substance use, substance misuse, substance use, I don't know.
Substance use disorder.
Whatever the new age, ADAP, what it used to be.
Yep.
To say, this is really important, this is part of your job to get these beds back online, so please do it.
I think the guy from Howard was quite.
Explicit.
So committee, we will,
See what we get back.
all right. I guess if anybody is listening from the Department of Health, it's sort of like, why does the legislature have to put instructive language in to do something that one would anticipate should be done as a matter of course to respond to a situation of having capacity actually being reduced? So, I don't think we'll put those editorial comments, Brady, in the language, but,
We'll add it to the web report.
yeah, would you please? But the only change is we're gonna add, DOC as a representative. Commissioner of DOC or a designate, is that, I think,
Yeah,
what you want after Commissioner of Public Safety? Okay.
are we axing this public safety or?
No, we're keeping.
The public safety's in there.
Okay.
Yeah,
Yeah.
They should be.
There will be a new sub B saying Commissioner of Corrections or
No, I think public safety, because they're oftentimes picking up when people
Yeah, no, I know, I thought somebody said take
take them on. No, no.
them off. Okay, I misheard.
on page
So
24.
we're gonna close that out, assuming, with the assumption that you are gonna add, Commissioner of the Department
Yes.
of Corrections or designate, okay.
On page 24, this is a new section E,
Yes, and
318.3.
thank you for doing this, finding the statutory reference to, I remember I had mentioned that with this language in spite of last year's bill. This old language is there, it was creating, concern that somehow there could be a waiting list, for this benefit. Never has happened, but, you know, and so this is simply to, strike that language that would, allow the program to stop taking new applicants, based on funding. They'll have to come back and deal with it through the BAA. So, committee, are you, okay with my request? Thank you for finding where that, language resided.
On page 25, this is a committee request. This is adding a new section E 329, amending the membership of the Vermont Deaf, Hard of Hearing and Deafblind Advisory Council to include a representative of the Vermont chapter of Hands and Voices, so that that representative and that organization will be a voting member of the advisory council.
So, this is, obviously, this is a national organization.
Yes.
And this is something you asked for, Rich.
Yes.
Can you just explain what this group is and why you're requesting that it be added?
Actually, I have to look back into this. They attend all the meetings and they, as I was told, and they attend all the meetings and they participate in all the meetings and aren't a voting member of the meeting. And the, advisory council, they asked specifically that they be attended.
So do they represent, the deaf, blind?
Yes.
Are they all of the above?
They, I think it's the deaf.
All right, I don't obviously have, not, I'm questioning.
It's
It all,
the deaf that
which is-
they represent.
all right.
And on page 26, this is a new section E 345.1. This was from the administration's technical letter. Section E 345 as it exists in the House version of the bill, did not include the bill back authority, for the Green Mountain Care Board.
So we also have the language that was requested by the board to change the bill back percentages.
Yes, so that is in section E 345.
Be right, but not here.
And so so this would add a section E 345.1, as recommended by both the Green Mountain Care Board and the technical letter to add the bill back authority in statute.
So it would be. This is already section 345.1. We've got an E, would there be a new? The bill back is already in all we're doing is amending the percentages in existing statute, so, is that before
So
this edition?
in the bill, there's a section E 345 where the percentages are amended. And then a new section E 345.1 will be added to add the bill back authority to statute.
Do the hospital community reports currently include ambulatory care, surgical centers?
I'm not sure.
I mean, because maybe that they're adding another entity for billback purposes, so it'd be interesting to know why they're doing that. Because I don't remember whether the surgical centers are included in the hospital community reports.
Who requested this segment in the technical letter?
The technical letter and the care board,
They both,
so the bill back authority was not included or perhaps removed. I would have to double check from the statute that section E 345 was amending.
so that removed in error, so the authority for bill back.
So the billback
Yes.
authority for surgical centers, but then the question is, will we be seeing further or additional requests for billbacks from other types of clinical?
Only if they recommend it, I think.
I don't know whether then the community report or hospital community report. or not.
No, this would be a new section.
Well, I don't know the answer, either. So,
So the section of statute that was erroneously struck in the House version of E 345 does not reference ambulatory surgical center quality reports.
That's not.
did it strike the authority to assess and collect?
Yes, by error from how it was sent over.
I guess the question becomes one of, and I don't know who's gonna follow up on it, but to make sure that, I think your question, Ginny, is, do ambulatory surgical centers and administrative. Well, this is reports. Yeah, so, the question is hospital community reports, are we assessing ambulatory surgical center quality, under bill back now? Is that your question? Are they subject to bill back now?
Yeah.
Or are we adding here?
Yeah.
And someone contact the board and make sure we've got this correct, and we'll hold it pending confirmation from the board.
They want that.
I see a lot of hospital stuff and.
So,
Yes, so the language as it was over struck the entirety of each one. That was unintentional. The administrative drafters did not mean to actually strike the entirety of that section.
Thing we have to send.
so Grady, thank you. This is really a lot all in one package. We've moved through a lot of things. We still have some,
There's two pieces, Amy, I have one piece on the shall to may that was requested by Capstone for fuel assistance. And you got a copy of that, and that we don't want to lose. And then, I just sent you a piece of language that Jimmy and I have been working on. for nursing homes?
Shall to may or may to shall. The language I think is currently the commissioner.
From shall to may.
Okay.
Could you read what we're changing here?
Here.
I believe Senator Westman is referring to the expedited fuel assistance.
Yep.
So as it's currently,
Is this supported by the administration?
Oh, I can check.
Because what you're doing is, removing a required limitation.
Yeah,
And you're liberalizing the program.
Yeah.
So the question is, what is the impact of doing it, and does DCF support?
DCF, just allows DCF to do it if they want to. My understanding,
it allows the community action agencies to do it.
well, allows, but I thought it allowed them to do it with permission. Like when there's, at the end of this heating season, if there's more federal money to draw down, but somebody already got a award at the beginning of winter, they couldn't give them another.
Right.
But they have money to get it out.
But she's right, it liberalizes.
Yeah.
We'll run it by DCF.
that language, it is may in House version already.
It's in, already, because that's not what the community action
Yeah.
agencies sent at the end.
As it appears in the House as introduced E324, it reads, the Commissioner for Children and Families or designee may authorize crisis fuel assistance. Page 4.
Yeah, it's on page, 164. The DCF or designee may authorize crisis fuel assistance to those income eligible households that applied or expedited, crisis fuel grants authorized pursuant shall count toward the one crisis fuel grant allowed per household. So
It does liberalize.
it does legalize it, and we close that out, so I have okay by annotating.
I've got all.
My concern is not at the end of the year where you may have some money left over, but if you liberalize the policy at the beginning of the year,
Well,
I'll
I'll check with DCF. I will tell you that Capstone called and they said what they did was they left money on the table, and this is an attempt to try to not leave money on the table.
did that money go though for something else fuel related or weatherization or whatever, because sometimes you might move money.
Does this change statute or this is?
This is session law. This is annual language. It wasn't changed from the governor.
Because what capstones want to change is 33 BSA 2609, where this says shall, they want to change it in statute from shall to may.
Understood.
Yeah, 2609B. I think we better understand what we're doing here.
I'll contact the commission.
So it's a request to amend statute, not this section of the bill.
Yeah, that's
Understood.
in the wording is a little bit.
Yeah.
I'm,
But we need to figure it out, but that's just what the request is.
and my concern is if you liberalize the policy and you can say you can get more than one, it could very well be that you run out and you create a need for budget adjustment or some infill. If you don't have, it's one thing to know that you've got money left over at the end of the year, but if you take the cap off or the limit of one, at the beginning of the season, and how many it's harder to determine what perhaps is going to be the total expenditure. Okay, I'm not gonna, close that out.
Yeah.
Or, we had closed it out with the limitation. This is requesting us to revisit and liberalize it, and that's what we need to confirm.
Or it's keeping that part of the bill the same, but adding the part where we're changing the statute.
If you change statute, that section would have to change as well. The second sentence of that section says that the grants count toward the one crisis grant. So if you change it in statute to a may, you don't have to probably just strike that second sentence.
Of course, okay.
All right, so
Send it to the commission.
I wanna go back to the surgical center questions.
um,
When we get there.
all right, yes, let's go back.
So, I just looked up, the quality report, ambulatory surgical center quality report. This is what I got. It's a table that demonstrates, a comparison of the different surgical centers in the state, and they have too few people to report in many of the sections. They have Green Mountain Surgery Center, Vermont Eye Laser Center, and then compared with the national average. I'm not sure how much this costs, but it would seem to me that the costs really lie with the center itself and record keeping. So I think we'd have to ask the question about why are we billing back to get money for this?
Are we regulating? We're setting their budget?
Yeah, they're regulated through.
No, but to the board?
Not, are they only through hospitals? Yes, they receive a CON to the board.
But these
But I'm
are
not
not
sure.
separate, right? Separate from hospitals?
Yes, unless the hospital, such as the one being applied for by UVM, becomes.
Part of that hospital.
Yeah, but so the laser center is independent, as is the Green Mountain Center. I'm trying to figure out
Well, we need.
why they need more, what money they need in order to do this, and perhaps they're going to help the surgical centers do the work, because it looks like they're the ones that are collecting the data. I don't know the answer to this.
No, we'll see if we can find out from the board. I don't know whether anyone is listening.
This report is dated 11/15/22.
Well, I guess the question is, but if we go back to the percentages and the email that we got, from the Green Mountain Care Board in terms of who pays what, the, ACOs are billed, the hospitals are billed, et cetera. And so that's what drives who's charged and how, what percentage. Are surgical centers on that percentage of what you pay list? You know, Grady, what I'm talking about.
Oh, so
Hospitals will pay 40%. I think they moved it down to 38 or something and, so do you have that email? That came from the board requesting those bill back percentages get changed. If in fact surgical centers aren't on it, then they aren't,
They're adding them. They could be adding.
well, not if they don't include them on what percent we're allowed them to bill back. That's what I'm trying to find is that email.
Well, they're collecting from general hospitals.
I know. I'm gonna just hold it for now. If we could find that, email that we got from the board saying these are the new, percentages we want to, allocate across those, bill back entities. So rather than our spending time to do something, I'm gonna suggest that at 2:30, and we just have Jen Carby, and we'll follow up, maybe I can find the email that I got from the board. Updating the percentages, I imagine Nolan must have that as well.
The agreement for board changes, yeah, I have
Yeah,
that too.
you have it too? Well, the question is, are surgical centers subject to the bill back? If you look at that list of how the percentages are picked up by.
My ambulatory cervical center?
Yeah,
Like they're billing back to a hospital to pay for, I don't know what the relationship is between the surgical centers and the hospital and the bill back or the reporting.
and this is for the Commissioner of Health. I'm sorry, this is Commissioner of Health.
Yes.
It's not the board, it's Commissioner of Health we've got to look at, so those percentages don't help us at all. So hold that thought.
What the board is billing back for the payment of the
Yeah.
reports.
So the language that was erroneously struck in E 345 said that the board may also assess and collect from general hospitals licensed under chapter 43 of this title expenses incurred by the Commissioner of Health and administering hospital community reports under section 9405B of this title. 9405B of that title is hospital community reports and ambulatory surgical center quality reports.
Okay.
So I don't believe that this is adding, it's clarifying
Yeah.
what that section
And
of
it's all
statute.
collected from general hospitals, so, so I think probably we've turned ourselves inside and out, so answer our own questions. All right, thank you, Grady. I'm gonna have you, relinquish your throne to,
So the committee can close that section.
yes.
Okay.
And now we'll go on back to transportation and our three very substantial amendments.
It's exciting,
Oh, exciting too, huh?
right? Transportation is a hot topic here.
These are, oh my God,
Traffic calm too.
this is all 8 pages, Jen, to do those 3 things? Oh my gosh. Okay. All right, so,
Watch out.
A lot of it is to take things out and come back in with some,
okay, so, why don't we then, have you just run through what is here, probably page 2 is the first of 20.
yes, Jen Carter from the Office of Legislative Counsel. So there are 4 instances of amendment here. This should be 868.
Do you have an extra one? Did you get one?
Did you have?
We had.
That's where it is.
So
Yeah.
go to
Anyway.
Grab one somewhere there.
the amendment.
Or she has to be.
Will be,
All right, so this is making some changes in the complete streets statutes, specifically
It's
around.
not even twitching yet.
So when we get to the calming measure.
All right, number 4.
So, right, so number 4 in the bill, as it came from the Transportation Committee, said that when desired by the municipality, this would add or specifically identified in the regional plan. And then there's also some. And then in the next piece of it on page 3.
So you do all those changes simply to add or specifically identified in the regional plan.
Well, and the changes in the next one, these are all done as one section of the bill, section 24, amends 2 sections of statute in a row. And so
We're now on to page 3, the
so we're
supplemental.
now on to page 3, and the supplemental written determination, it's just a modification of that language. So the bill as it came from down the hall says,
they're straight to now.
The language that we decided,
I was just looking for the,
that we couldn't understand anyway.
but that's where, that's the strike.
oh, yeah, it was, yeah,
Yeah,
it was-
I guess,
too hard to figure out from all line,
Yeah.
we can, but.
sure.
So in existing law, if a project manager faces a written determination in full or in part on certain principles, then they have to provide a supplemental written determination with specific details. But then it says, but shall not need to address in the supplemental written determination any design elements desired by the municipality. This would instead take out the but not need to address, so it would need to address. Supplemental written determination shall also address any design elements that were desired by the municipality or specifically identified in the regional plan. That's that new language added in the previous page, but that were not incorporated. So that must address anything that design elements that were wanted, but were required, but not incorporated. Or identified, but not incorporated. And that same change is made on page 4, except in this case, so it's the same language changes, but in this case, we're talking about municipal projects. In the first one, we're talking about state projects.
So Madam Chair.
Yeah.
Page 2, B at the bottom there, lines 14 through 17. That language seems weirdly open to me. Support the land uses that develop and evolve in tandem with transit and
It
accessibility.
came from the house.
I
I'm not
understand,
sure what they wanted. It's,
well, including those that
Everything.
provide enhanced benefits to the public, as though it could also include ones that take away benefits. Like, but saying that they develop and evolve in tandem, it's like, that could include anything.
We declared a victory and let the language go. This was drafted over in the House.
I would move the strike section.
How do you evolve in tandem? It's really-
Because literally, it would be difficult to mention something that couldn't slip in under that language. And it basically is the guiding principle for how they're gonna do this.
Well, Mr. Chair,
This is part of the, student that they have to write the.
So see, a park and walking trails is approved health, and then access.
It says for all transportation projects and project phases managed by the agency or municipality, they need to incorporate these principles that do this. But then it's completely unclear what it's talking about. If it evolves in tandem,
don't you think it's like interpreting a poem?
well, yeah,
Yeah,
which, so I'm
that's why,
offended by the ambiguity. In this context, but I love the ambiguity in the poetic.
well, we just elevated this discussion to a new level.
Yeah,
Oh, what does a poem mean?
can be anything.
Oh,
But when you're talking about land uses, transit and accessibility, and it includes those that provide enhanced benefits, but it seems to imply that there could be lots of others that don't. I don't know. It doesn't seem to me to add anything, and it gives me a lot of agita about what could be slipped on in under.
all right, so. Do you,
I don't think it's something. Like, since it's vague, I don't think it's what the House wanted it for some reason. I think more is what they wanted was 4 and then A. B is kind of a catch-all, I think, is what they're trying to do. But I agree, would be hard.
it's sort of gratuitous language.
I think
You could take out,
Don't have Michelle back, so, but we could take it out and then it's the House.
but don't take it all out, you just take out, land uses, and then take out that whole phrase to the comma after accessibility. Just put it including those that provide enhanced benefits to the public. And then health, employment, services.
But maybe we don't get as such as, take that out,
Huh?
take that out. And
Take
after
the-
period,
take
enhance
the-
it to the public period.
Take out evolving in tandem with transit and accessibility. Implies it's all happening at once.
All right,
I would say support land uses that
Take it.
provide enhanced benefits to the public, such as through improved health and.
That's it, I agree with you.
or do we want it even such as blah, blah, blah,
Yeah.
enhanced benefits to the public period?
I mean,
Okay,
why do it if it's not providing enhanced benefits?
Yeah, I don't think you need the sunshine.
and then take out.
All right, so we have two different things, we can wordsmith it or we can delete it, strike it.
Read it.
All right, we can negotiate that in committee and say it's lack clarity and we thought it was more gratuitous.
B out,
Take me out,
merge
that's
merge A into 4. Okay.
Yeah. Mhm.
We can do that.
Okay,
Then work it out.
All right, so now we are on
This is
page,
a transportation bill.
on page 4 and on page 5.
we can't help ourselves.
This is, it's just changing a phrase throughout. It's changing the phrase road user surcharge to EV infrastructure fee, electric vehicle infrastructure fee throughout, these sections. Sections 27, 28, and then 29 is the future repeal of some of that language, so it also needs to be.
Okay,
All right, the third instance of amendment is truly technical. And some of you know I don't say that lightly. But there is in section 33, there's a deletion of the report in section, so in 19 VSA 7 subsection K is repealed in section 33. So in section 34, we're getting rid of the reference to 19 VSA 7K in the list of reports that go on and aren't subject to the periodic review for potential review. So it's just reflecting that we don't reference that anymore because it was just repealed in the previous section. And finally, the fourth instance is adding a new section to the bill, amending the mileage smart income eligibility language, and the actual change is on page 8, where it requires that mileage smart shall in subdivision 2 provide not more than 1 point of sale voucher of up to $5,000 to an individual who's part of a household with an adjusted gross income that is at or below 80% of the state median income, provided, and this is the new part, provided, however, that the agency of transportation may reduce the income eligibility threshold based on available funding or applicant volume or both in order to prioritize vouchers for households with lower income.
Good.
So what's that? What is that? Beyond for money?
Well, it means that
80%.
it means that if you had a high volume of applicants and your funding
But
is.
he's asking, what is 80%?
What is 80% of the state median income?
I don't know.
We're just now.
50,
I got federal poverty level,
Yeah, I don't know how those really,
but I don't know how they relate.
Median income.
I don't know, but they seem to be doing this already, so,
They are.
yeah, this is just,
They're doing it at 80.
This just gives the flexibility to lower the threshold if you've got less money or hot on applications. So that you can direct the money to the house applicants where the needs are greatest.
But if somebody called you and says, there any help for buying an electric car, yeah, if you're 80% of the state median income, you can get $5,000. Well, they're gonna say, well, what's the median income?
It's 57. 57.9.
So 60, so it'd be,
That's what they're saying. Sometimes they think they can lower that.
that's
Okay, so what we have here, our amendment's been amended.
yes, that's true, I mean, gave you a new version, with just that.
Only just that one, which is basically the striking of B on page 2.
Strike B, and we'll just put A, attach A to 4, so it's all one.
So, while Jen is doing that as we speak, I'd entertain a motion to move the bill favorably as amended.
So moved.
sorry.
All right, Sarah Westman and Senator Strongman.
Rayburn, Lyons,
Yes,
Ridgely,
Yes.
Sears,
Yes.
Star,
Yes,
Chess, Gitchell.
I'll get Vicky's vote one of these.
You
So now that you voted, I'm back with a question, because I realized the references in, where are we? In that language that's the same for both the state project and municipal projects on pages 3 and 4.
Yeah.
Talk about elements, design elements desired by the municipality or specifically identified in the regional plan. And I think the reference is to that for B4B that we just took out. So make it B4,
That's reference before.
reference B4,
Yeah.
and there's only one
Yeah,
B4 now.
That's a
Okay.
better way.
I would do it. Thanks.
So I think the reporter can be Senator Richmond.
It already is. And I can't be in the paper.
All right, so once, Jen has the corrected amendment, and Andy can take
I'll take
it
it.
on. So with that, I'm gonna suggest we take a break